Avelox, good for pneumonia, but can lead to glaucoma? Bilateral acute iris transillumination, or BAIT, is a reported condition that can present in patients after systemic fluoroquinolone use. In this video, we report a case of BAIT, its ocular consequences, and its surgical management with trabectome. Our patient is a 55-year-old woman whose medical history was notable for a recent diagnosis of pneumonia that was managed with oral Avelox several weeks prior to presentation. After an acute onset of bilateral blurred vision, ocular pain, and photophobia, she presented to an outside ophthalmologist. She was found to have intraocular pressure in the mid-30s and was given a diagnosis of severe iritis with pigment dispersion syndrome. She was started on steroids and ocular antihypertensives. She was found to be a steroid responder, and even with a low-potency steroid, her eye pressures were still uncontrolled on 4 ocular antihypertensives. On an initial exam, visual acuity was 25 OD and 20/40 OS, with IOPs of 18 and 30 respectively. The patient had bilateral transillumination defects with posterior synechii and 3+ pigment in the anterior chamber in both eyes. Gonioscopy revealed heavy pigment in the TM with boat appearance of the iris. Retinal nerve fiber layer analysis revealed borderline findings in the right eye, but showed clear signs of early loss of RNFL in the left. These findings corresponded with increased cupping and early visual loss in the left eye as well. The surgical plan for the patient was to undergo cataract extraction with synechiolysis and ab-internal trabeculotomy by trabectome of the left eye. The belief was that by separating the iris from the natural lens, removing the cataract and replacing with an IOL in the bag would allow for lack of rubbing against the iris, which was the believed mechanism of continued pigment release. This being resolved with the removal of pigment clogging the TM with trabectome would then help increase outflow. Her eye pressure on the first postoperative day was 13, and after a period of routine postoperative management, her IOP remains controlled on 1 combination agent. There's also been a significant reduction of anterior chamber pigment. Several reports have arisen describing the BAIT syndrome. Most authors describe a self-limiting condition that can be managed with topical steroids and antihypertensives. To our knowledge, this is the first case resulting in manifest glaucoma requiring surgical intervention. The trabectome remains a viable option for management of pigmentary glaucoma refractory to medical treatment. Ophthalmologists should remain aware of the association between systemic fluoroquinolones and acute pigmentary dispersion that can progress to glaucoma. Thank you so much for your attention.